Oncology nursing is a career that has many facets, both scientific and interpersonal. It is an evolving specialty, a progressive growth area, and offers innovative career opportunities. Oncology nurses share a passion for their highly stimulating and extremely rewarding profession.
You know, it's something that you've seen portrayed in movies, you've read about it, you see ads on TV about shocking moments in your life. But when I was told that I actually had breast cancer, it was just a feeling of shock.
When we are first meeting the patient, the main focus is to take that initial health history. But there is often so much fear and anxiety that we provide a lot of support and build a very important relationship right from those first few moments together.
I meet all patients before treatment begins. During that initial meeting, I invite family members to be there. This helps me to get to know the patient and the family better, and to see the family dynamic that they share. By knowing them better, I'm more able to help them. Because a member of this family is sick at home, the family has a lot of concerns, lots of preoccupations. So this meeting allows me to give them support and clear up any taboos and myths that these people may have in regards to cancer and cancer treatment.
I remember my shoulders just kind of coming down as this nurse was talking us through and just feeling, okay, we're going to get through this.
Treatment steps in the cancer journey can include radiation or chemotherapy, where the nurse's role is vital in assessment, follow-up, and intervention.
We continue to see the patients while they're on treatment. We assess them weekly at least, and sometimes more than that if we talk to them over the telephone, to see how both they are doing and their family are doing.
I was very concerned I was going to lose my hair. And I remember the nurse coming in and talking me through what chemo would be like. And I remember saying to her, you know what, I just don't think I'm going to lose my hair. And you know, the nurse could have just shot me right down and said, look it, you're going to lose your hair. Instead, she said, well, you know what, most people lose their hair with this treatment, but maybe you won't. And what she did there was just let me keep my hope. And, you know, it's like she had a lot of knowledge about the disease, but she knew about the person who was going through the disease.
Prior to receiving chemotherapy treatment, a patient will come into the clinic and I will do an assessment on them, and I will specifically check for any side effects that may be occurring due to their chemotherapy treatment. And each chemotherapy on its own can have specific side effects that may occur. So as part of my education as a chemotherapy nurse, I know which side effects to look for particular chemotherapy, and I will advocate for that patient to have support medications implemented to carry them through the treatment, or in fact advocate that perhaps a delay may be necessary.
The care of oncology patients occurs in many areas of a hospital or outpatient clinic. Patients hospitalized on oncology, palliative care, and medical surgical units benefit from special nursing care.
The nurse's responsibility is to look after the skin. If it's receiving radiation, it's very toxic to the skin, and if it's a surgical wound, chemotherapy can interfere with wound healing and the possibility of infection. And the whole package, it's all about seeing the patient as a whole and looking after them, monitoring them for any complications setting in from whatever the treatment modality they've just come through, and bringing it together for them.
An oncology nurse's responsibilities are varied and complex. There is a high level of scientific detail and technical knowledge to be learned. After a nurse obtains his or her nursing diploma or degree, there are many opportunities to pursue an oncology nursing career in many innovative directions.
If you still want to keep on going, there's also the certification in oncology. And then if you're having a more desire to pursue, there's also, I mean, if you don't already have your undergraduate degree in nursing, you could apply for that, and also you could apply for your master to become either advanced nurse practitioner or a nurse specialist in oncology.
The advanced practice nurse sees patient referrals from different members of the cancer team, such as physicians, nurses, dietitians, and social workers.
So we work very collaboratively, and I see patients with complex needs around symptom management, psychosocial issues or concerns, and really function within what we call domains of practice. So clinical practice, education, research, leadership opportunities, and really looking at system changes as well.
Oncology offers nurses the career opportunity to generate patient research in areas such as quality of life and long-term side effect issues. Clinical trials nursing manages new medical treatments being tested.
My role as a clinical trials nurse in oncology involves many aspects involved in the protocol treatment. We coordinate the patient's care right from the time they consent to being in a trial. We help to direct their physician appointments, their treatment appointments. We monitor their side effects very closely, and we have to document all of that information so that it then goes back to the sponsor, and all of that data is collected and contributes to the development of new treatments.
Hi, Mr. Thompson.
Hi, Sabrina. How are you?
I just have your magnesium for your dinner here.
Oh, good.
There are many positive stories in oncology nursing where patients are seen through intense treatment with the intent of curing their cancer. Oncology nursing in the incurable setting is as rewarding as palliative care. Oncology has evolved to treat patients in curable cancer more like a chronic disease, with very active and ongoing treatment intervention that improves quality of life.
My patients are assessed by myself, complete physical history and physical, and then I review their images with the physician, the radiation oncologist, and then together we discuss treatment options.
The oncology nurse fulfills several dynamic roles and often has considerable independence. Here's an example of the care in a community hospital.
I work with 2 medical oncologists, and when they're on call in the Emerge, I see patients in the Emerge. I see a lot of patients in our chemotherapy clinic, and then one of my very important parts of my job is to go to the inpatient unit and round on the inpatients on a day-to-day basis. So I have a lot of autonomy. I really love the work I do. I'm still excited every day when I go to work, and excited at the end of the day as well, which is probably not everybody can say that.
Oncology nurses play a vital leadership role that involves nursing assessment and intervention research. Accordingly, they attend and give presentations at oncology conferences. They develop various programs and tools to facilitate the work of their colleagues and improve patient care.
One of the patient education booklets was developed for women following treatment and really addressing some of the survivorship needs.
The joy for me now is bringing other nurses forward, especially young ones, and I never submit an abstract to a conference without collaborating with some young up-and-coming nurses. So I think one of my delights is to be a bit of a coach or a mentor or watch them grow and develop, and it's great to see the progress they make. They get so excited.
Oncology offers career opportunities in nursing administration. These administrative roles are a vital part of improving programs and healthcare delivery.
I began as an RN on an inpatient bone marrow transplant unit, and then moved to a regional cancer center where I started as a chemotherapy nurse, then a primary nurse, and then even moved into clinical trials. So there are so many opportunities that oncology has to offer, and I was really able to take advantage of many of them. But there were still other roles, actually, the role of the radiation nurse, and as well the oncology nurse in pediatric care, which crosses both an inpatient and an outpatient setting.
Each wheel has a hub, a center. That's what we are. All the spokes of the wheel point towards us. In the same way, we're a sort of a reference point for healthcare professionals. They look to us to come up with a continuous plan that follows patients through their treatment safely and soundly, and towards a good prognosis. That's the ideal case. And it's very rewarding to do this.
And the joy that you see in a patient when treatment has been successful is not matched by any other kind of nursing. And then again, when treatment may not be that successful, the compassion that you receive and that you give to help them reach the end with dignity is incredible.
It's just an ongoing relationship. It's not just surgery, chemo, radiation, see ya. It's an ongoing relationship, and I just feel incredibly indebted to so many nurses who, you know, people say, oh, they made a difference. They were the difference, and I really feel that we are part of the same team.